second part of this session, we'll have Q&A session with ma'am. So I request the audience to keep your questions ready for discussion in the later half of the session. Ma'am, I invite you once again.
Hello, good afternoon everyone. Thank you Dr. Neha and Shikha for such a nice introduction. In fact, it's my privilege also to interact with the students of this college, this Ranchi college. I have heard a lot about this college, but somehow I never got the opportunity to students of this college. Take this opportunity to enlighten on certain topics which affect all of us and yet we shy away from talking about them. Okay,
Ma'am,
so
you're not audible actually.
Voice is not clear.
Your voice is not coming, ma'am.
Uh, Veer, sir, I think you can put your mic on mute because
Yeah, yeah.
more than one mic is unmuted
Can
in
you hear
Netflix.
ma'am's voice? Can you hear the ma'am's voice? Is ma'am audible to you?
She was audible to us, but then I think there was some echo sound because so many mics are on at the same time. Okay, we can see ma'am, but I think she's not audible to us. We can't hear you, ma'am. We can see you speaking, but then your voice is not audible to us. Veer sir, can we have ma'am from your system because you were pretty audible to us? So if we can go without a PPT, that would also do. But
And
if
what you'll do is you can speak on this one. Yes.
but sir, make sure that we use just one system from there because there are multiple mics on because of which the echo sound is there.
No, you're audible. You can,
okay. Audible now?
Yes, ma'am. But we may request you to please have just one mic on the unmute. Yes, yes, ma'am. Yes,
Okay. Am I audible now?
yes, ma'am. You're audible very clearly.
Okay.
Again, this is music only.
Yeah, hello. 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 Correct?
Yes, sir,
Am I
you're
audible,
audible.
ma'am?
You're audible.
Am I audible?
Yes, sir, you're audible. So there's a request. Can we have ma'am speak from your ID,
Hello?
the ID that is working well? Yes, ma'am.
Hello?
Yes, ma'am, you're audible. In the meanwhile, I would request the audience to please be patient with us because these are some limitations of working online. But I hope this will get resolved very soon. Yes, Veer sir, what's the update? Can we start?
Hello?
Yeah, I'm just. But she's speaking.
Hello?
Can you hear me?
Yes, I can't hear.
Yes, ma'am.
Hello, good afternoon, Dr. Neha. Am I audible?
Yes, ma'am, you're pretty audible. Yes, ma'am.
Okay, chalo. Let's ignore the technical glitches. My IT team is extremely sorry for that. And let's resume the discussion about one of the most important topics in our. So before we start the discussion,
Hello. No, she's just correcting.
So before we start the discussion, I would like to thank Shikha especially for such a nice introduction and asking everyone to join the meeting and have a lively discussion here. Am I audible? Okay. Okay. Before we start the discussion, I wanted to just put the things in the perspective. I was like, why, as we always claim, we are half of the world. Yes, half of the world, we contribute around 50% are in the reproductive age group that capable of having pregnancies and those who have regular menstruation. Menstruation is so universal to us, yet we avoid cultural taboos, practical health, about it. Okay.
Hello.
Yes, sir.
So what I was saying is okay. What I was saying, putting the things in the right perspective. That am I audible? Again, I have doubts whether I'm audible or not.
Yes, ma'am, you are audible.
Shikha, am I audible?
Yes,
Ma'am,
ma'am.
you're audible, but so
But
many mics are on, and that is why we have an echo sound. There are two mics on. I think Veer sir's mic is also on, and parallelly two mics are on. So, and also, ma'am, I guess the network connectivity over there isn't very good. It isn't supporting your voice. It's breaking in between.
That is being Hello? Hello? Am I audible
Yes, ma'am.
clearly?
Not clearly, ma'am. You're audible, but then there's some disturbance in between.
Okay. Actually, we have some network issues here also.
Okay, ma'am.
That's why.
Ma'am,
But I would
you may
like to
continue.
request.
I think it is sounding better.
Yeah, I'd like to request to bear with us. So what I was talking about is lots of confusion, lots of cultural taboos, which prevent us about talking about menstruation, and yet we suffer in silence almost every day. So today we are here to discuss about this pretty important issue. सबसे पहले तो मैं कहना चाहूँगी कि let's ignore the for the possibility of pregnancy each month. So each month, saying each month is not the precise thing. Basically, each cycle, we undergo changes in anticipation of a possible pregnancy, and if it doesn't happen, then again we start from zero. This is how a woman's body develops, ages, and finally we enter senescence, which we commonly call menopause. The usual cycle length can be anywhere between. Every woman has a unique cycle defined by its cyclicity, volume and pattern of flow, number of days of flow, and yeah, and any associated symptoms which we commonly call premenstrual symptoms. Coming back to the menstrual cycle, we can divide the menstrual cycle into 4 phases. that is the first phase where we start from the scratch, that is level 0, that is the menstruation, when we have a visible flow of blood from our genital tract, which we call menses in common way, or periods, what we describe in common parlance. Thereafter, once the bleeding stops, we have a follicular phase where the ovaries start developing eggs in anticipation of pregnancy, and they also secrete certain hormones which prepares the uterus in anticipation of pregnancy. And then comes a very short phase when the egg is ready, and that is called the ovulatory phase, when we are the most fertile. We are not fertile, let me emphasize, we are not fertile for the entire cycle length. We are fertile during this short 2 to 3 day phase, which is called the ovulatory phase. Thereafter, once the ovulation has occurred, that is the release of the egg has occurred, the secretory changes ensue in anticipation of pregnancy and receiving a fertilized egg in the uterus. So we can divide the whole thing into 4 phases, as I have emphasized. So let's talk about menstruation, which is the most visible event in a menstrual cycle, which concerns everyone. No, why? See, our marketing team is also a bit embarrassed talking about menstruation. So let's. Good afternoon, sir.
I'm leaving. Goodbye.
Okay, good. No goodbye, sir. We'll meet again. Yes, sir.
I'm going now.
Okay, sir.
How much time will it take?
15 minutes.
15 minutes.
Yes, sir.
Let's see.
Okay, sir. Thank you. Oh, that was my center head leaving today. He is leaving for Hyderabad. He has resigned from our institution, so it was a short goodbye to him. I'm sorry for the interruption. So coming back to our topic, menstruation. What is menstruation? This is a cyclical shedding of lining of a woman's uterus, which we describe as endometrium in our medical terms, along with blood, mucus, and other secretions through the vagina. As I earlier emphasized, it is unique for everyone. It is characterized by cyclicity. Everyone has her own cycle defined by its length. It may be anywhere between 21 to 35 days. A duration, unique duration of flow of blood when she is menstruating. It may vary anywhere between 2 to 7 days. Volume of flow, that is the amount of blood loss which she encounters, that is also uniquely her own. And it is often preceded by certain premenstrual symptoms like heaviness in the breast, bloating, headaches, or weight gain, which we commonly describe as premenstrual syndrome symptoms or PMS. Now, when does our menstruation start? It there is no fixed age, but it starts around 10 years or anywhere between 8 to 15 years of age. And anything other than later is also a matter of concern. So this is the range. This is the range when we can expect the start of menstruation. It is associated with physical developmental changes, which we commonly see in adolescent ladies, and what we call pivotal changes, that is changes in the breast, appearance of axillary and pubic hairs, and certain emotional changes also. It is what makes us women. Our own way of thinking develop, certain demeanors develop. This is also because of the hormonal changes that start with the start of menstruation. And yes, the initial reaction of children experiencing the first menstruation is of fear. They are afraid where the blood is coming from, and often they are ashamed. They try to hide the thing, and they are thoroughly embarrassed. So this is what we are going to talk about. This is not something to be embarrassed about. This is our own physiology, and we should know it in in a way to manage better way for us. तो कम हिंदी में तो बात करनी ही है, सबसे ही बात करनी है. Everyone is welcome to this discussion. मैं यही कह रही थी कि menstruation start होने की age जो है, usually we have this is around 8 to 15 years of age. इससे पहले या इसके बाद start होना है is a bit abnormal and we should seek medical help for that. Coming back, once we start menstruating, हम लोग जब start करते हैं, it's a cyclical process as earlier emphasized. So the ladies should be prepared about it. No, I'm going to face it every month or maybe in 1.5 months. It maybe कि अलग अलग सबकी length cycle length अलग अलग होती है, लेकिन everyone should be mentally prepared about it. So the first thing is don't panic. मतलब किसी को भी इसके बारे में बहुत ज़्यादा concerned या panic होने की ज़रूरत नहीं है. It's a physiological thing which keeps us apart from the male community. It is uniquely our own and we should not be ashamed or fearful about it. To manage our menses, I would like to advise everyone to keep a track of their menstrual pattern. That is what we call menstrual diary. When did you start your menses? How long was it? Did you experience any symptoms around it which bothered you? कुछ परेशानियां हैं, ये सब जब हम लोग डॉक्यूमेंट करते हैं तो इसको एक टर्म दिया जाता है जिससे हम कहते हैं मेंस्ट्रुअल डायरी. इट शुड बी फॉलोड बाय एवरी लेडी. हर किसी को फॉलो करना चाहिए सो दैट दे नो व्हाट देयर पैटर्न इज. उनका अपना पैटर्न क्या है. इट टेक्स सम टाइम. मैं बताऊं कि 2-3 साल आफ्टर स्टार्टिंग ऑफ मेंस्ट्रुएशन इट टेक्स टाइम टू स्टेबलाइज द पैटर्न ऑफ मेंसेस. सो इनिशियल जो भी है जैसा भी है, वी शुड जस्ट वेट फॉर द थिंग्स टू develop in their own way, and unless it is bothersome, if it is like heavy flow or continuous flow or very painful menses, then definitely medical help leni chahiye. Otherwise for initial 3-4 years we should just wait for the changes to get stabilized. एक पैटर्न सेट होने के वेट करनी चाहिए हमें. So once the menses starts, the next ladies encounter is a choice कि उन्हें क्या चाहिए अपने मेंसेस को मैनेज करने के लिए, अपने ब्लड फ्लो को कैप्चर करने के लिए. There are lot of things available in the market, starting from a range of sanitary pads, tampons which can be inserted vaginally, and menstrual cups which are fitted in the vagina and they capture the blood. That's good. Okay. I can see this. So I was talking about what are the menstrual products available for us to use during our menses. So it's a completely personal choice, but yes, young unmarried ladies should avoid using tampons or menstrual cups as it interferes with the hymenal anatomy and some hymen rupture may occur. So sanitary pads are the safest and the widely used product for menstruation. So once we have made the choice of what to use during our menses, another question comes, how to maintain menstrual hygiene. Menstruation के around साफ सफाई maintain करना is very important because lack of hygiene during this period when you are pouring blood, it's like it introduces, it invites a lot of infections, the complication of which may be short term like abdominal pain, fever, urinary infection हो सकता है, और लॉन्ग टर्म अगर इन्फेक्शन बहुत ऊपर तक चला गया तो इट मे ब्लॉक योर फैलोपियन ट्यूब्स and may result in infertility as well. So how to maintain menstrual hygiene? Everyone should take bath as usual even during menstruation. There are many views regarding this. Taking bath, water to wash the increases from inside is coming, so it doesn't affect. So you should follow your routine. हर रोज नहाना is important. Cleaning yourself is very important. And you should always follow your normal in day-to-day life also. You should not skip your school. Pads should be pending on the floor or every 6 hours. हर 6 घंटे पे पैड बदल देना चाहिए so that no blood accumulates, which may act as a source of infection. While cleaning yourself during menstruation, always remember, always wipe from front to back and not from back to front. Here again this. Am I audible?
Yes, ma'am, you're audible.
Okay, so what I was talking about is how to maintain hygiene during menstruation. So I was emphasizing that while cleaning yourself during menstrual periods or otherwise also, we should always wipe from front to back instead of from back to front. Otherwise, infection may be introduced in your vagina. Never douche. That is, douching is a practice of washing yourself with water. Lot of water is pushed inside vagina. This is a very unhealthy practice as it introduces outside bacteria inside your vagina, which may climb up into your reproductive tract and may cause infection. Never douche. You should clean it from outside. Never introduce anything inside your vagina. Safely dispose your menstrual waste. It should not be thrown anywhere, or it should not be disposed of in a drain or a pan. You should take care of it. Wash your hands every time after disposing your sanitary napkins or tampons or menstrual cup, whatever you are using for that. So menstrual pain is one of the commonest symptoms. शायद ये हम सब experience करते हैं, but few people manage it according to their own way, and some people definitely seek medical help. जो लोग भी medical help seek करते हैं, definitely we are convinced that they are bothered, their day-to-day activities affected, that's why they are seeking medical help. Menstrual pain हर कोई experience करता है, and घर में कुछ remedies होती हैं which we can easily use, like hot water bags, putting hot water bags over the lower abdomen. ये काफी help करता है in alleviating pain. Keep yourself active. Your mind should be diverted. अपने आप को divert करने से definitely pain perception घटता है, and it helps a lot. And if these things don't work for you, आपके लिए ये काम नहीं करते हैं, then definitely you should seek medical help and take medications. Many medications are available. बहुत सारी medicines हैं which are absolutely harmless, and I should emphasize that किसी को भी सफर करने की जरूरत नहीं है when we have so much available for us. Now we are coming back to the things why we don't talk about menstruation. There is a lot of social taboo. हम लोग किसी से भी बात करने से परहेज करते हैं because we think कि this is something to be hidden. छुपाने की चीज है, हमें किसी से बात करने पे लोग पता नहीं क्या कहेंगे. But no, taboos should be broken. There are so many taboos, like we have also seen in our lives that many girls skip their schools because of menstruation. They are barred from attending any religious activities. पूजा पाठ में नहीं जाना है, मंदिर में नहीं जाना है, किचन में खाना नहीं पकाना है, and physical activities like sports नहीं करना है, otherwise flow बढ़ जाएगा. 4-5 दिन मेंसेस नहीं नहाना है, these are totally bullshits. इन सब चीज़ों को दरकिनार करके हमें अपनी एक रूटीन लाइफ जीनी चाहिए इवन ड्यूरिंग मेंस्ट्रुएशन. दैट इज व्हाट आई वांट टू एम्फसाइज ड्यूरिंग दिस टॉक कि नो, these are false things. You should never give an ear to these things. भगवान ने हमें ऐसा ही बनाया है एंड दिस इज समथिंग about which we should not be ashamed of. We should go to the temples as usual. We should cook. We should indulge in outdoor activities as usual. The fact is, what I was saying, it's a physiological process. ये हमें डिफाइन करता है, ये हमारी अपनी यूनिकली एक इंटाइटी है जिसे हमें मैनेज करना चाहिए. हमें सीखना चाहिए इसके बारे में कि ये क्या है और क्यों होता है, rather than avoid talking about it, suffering in silence. चुपचाप सफर नहीं करना है. And this is the time when you are most vulnerable to infections. Infections सबसे ज़्यादा इस टाइम पे होते हैं, outside और inside. So hygiene is very important. And menstrual pattern is totally unrelated to food. बहुत लोग कहते हैं खट्टा खा लेने से ब्लड फ्लो बढ़ गया. नो नो नो, इट इज नॉट रिलेटेड टू इनटेक ऑफ food. Whatever you eat, you are going to bleed like what you are expected to bleed. Don't think about it. You should indulge in regular activities. अपने रोजमर्रा के काम हर किसी को फॉलो करने चाहिए. It should not be an excuse or it should not be a reason to skip your normal life. Equality, this is what everyone is talking about. Let's talk about menstruation also. Menstruation doesn't put us behind others, so we should be like full and full in life during menstruation also. So coming back to the administrative people, what are the prerequisites for menstrual hygiene? हम लोगों को क्या इंश्योर करना चाहिए so that everyone is able to maintain menstrual hygiene? Privacy is the first thing. We should provide girls with a proper private place to change their sanitary pad, dispose of their sanitary waste. They should have an access to clean water. साफ सुथरा पानी मिलना चाहिए ताकि वो पहले और बाद में साफ सफाई मेंटेन कर पाए. Disposal of waste, whatever waste we are having, it should be disposed of safely to minimize infection to the person handling it and others also. And this should be done in a very friendly environment. Let me emphasize this because there are many male members also in the college, and it should be like it's a very natural thing which happens to every girl, and everyone should understand कि no, this is not something जिसके बारे में उसको हम लज्जित करें या उसको अवॉइड करें. एक अपने व्यवहार को बदल दें. It should be a friendly environment. Okay, it's fine. It happens to everyone. It should be like that only. Now coming to some of the common problems we face during menstruation. Irregular menses. Irregular menses means that we don't have a set pattern of menses. Like we may have very frequent menses, that is a mens occurring every 15-20 days, less than 20 days, or a very prolonged menses, that is once in maybe 1.5 to 3 months, or no menses, that is amenorrhea. We may have painful menses. Pain is a very common symptom during menses. It affects around 50% of the ladies. Some ladies experience very heavy flow during their menses. Every symptom has its own reason, but let me tell you, painful menses are the commonest thing afflicting the girls, and many times they skip their colleges, schools because of that. So it should be managed. Let me tell you, taking painkillers during menses doesn't affect your health. आपके स्वास्थ्य को नहीं affect करता है. So you should seek medical help and take medicines as advised by the doctor. Many girls come to me and say, आपने तो लिखा था लेकिन मैंने नहीं लिया because painkillers are harmful. No, painkillers are given to facilitate normal life. It's not harmful when you take it for 3-4 days. So please, अगर किसी को भी इस तरह के symptoms होते हैं which cripples their daily life, they should take medications. Heavy menses should be definitely investigated. Investigation हो जाने के बाद अगर कोई कारण नहीं मिलता है तो भी that can be managed with medications. Irregular menses, PCOD is a common problem जो सबके दिमाग में आता है. कोई भी जिनको पीरियड्स नहीं हो रहे हैं रेगुलरली, प्रोलॉन्ग मेंसेस होते हैं, सबसे पहले यही सवाल उठाते हैं कि मुझे पीसीओडी तो नहीं है. पीसीओडी इज बेसिकली अ हार्मोनल disturbance in the body which is manifested in prolonged irregular menses. But not every irregular mens is a PCOD. So you should seek medical advice about it if you are having irregular menses of recent onset or right from the menarche. That is, whenever you started your menses, you are having irregular menses, once a medical consultation is required. Vaginal discharge or irritation is a common problem. बहुत सारी ladies आती हैं especially post menstruation because of using of sanitary pads and all. They have irritation in the area that can be managed with infection and allergy. That is the common cause of this symptom, and it can be managed easily with medication. Some of the ladies, कुछ महिलाओं को right in the middle of their menstrual cycle they experience pain. That is the ovulatory pain. Mid-cycle pain is mostly ovulatory pain, and it usually subsides in 12 to 24 hours. 12 से 24 घंटे ही ये पेन रहता है. Anything lasting longer than this should be brought to the attention of doctors. Any swelling in the vagina, either because of use of pads, irritation or anything, must be dealt with the help of medical professionals. Now, some of the useful tips while discussing about menstruation, I would like, from my own experience, मैं ये कहना चाहूँगी कि it's very useful to track your cycle. So, what I earlier emphasized, maintaining a menstrual diary helps you. It helps you predict when you are going to expect your next menses, whether you are experiencing any change in your menstrual pattern. ये सब चीज़ों को predict करता है, and it also tells you when to seek medical advice. Whenever, either during menstruation or otherwise, you should keep the private area dry. The practice of douching, that is introducing fluid in the vagina whenever you use your washroom, is totally prohibited. It affects, it infects you, because your vagina is inhabited by many friendly bacteria. Whenever you introduce or interfere with that system, immunity is at stake and you are prone to more infections, commonly manifested as lower abdominal pain or vaginal discharge. So please avoid it. I know many of you are doing that. Please, that is totally physiological. You don't need to wash yourself every time you use your room. Always clean from front to back. This is something I would like to emphasize, because your anal area is full of bacteria. Whenever you wipe from back to front, you introduce infection into the vagina. Vagina में infection introduce होता है. So always remember to wipe from front to back. And we know 50% of the ladies in our age group are sexually active. Whether school-going, college-going girls, it's a taboo. People don't discuss about it openly. But being sexually active होना गलत नहीं है, but putting yourself at risk of infection, unwanted pregnancy is definitely bad. So use contraception if you are sexually active. Sexually active लोगों अलग-अलग तरीके से sexually active हो सकते हैं. जो लोग regularly sexually active, regular intercourse, they are regular with their partner, they should be using a fixed form of contraception. And let me tell you, oral contraceptive pills are a very, very good option for them. That is 99% effective, and it also regulates their menstrual cycle also. So those who are in regular relationship should use oral contraceptive pills after seeking medical advice. And those who are kind of once in a while sexually active, they should definitely use various methods of contraception. Condoms are the commonest. So that avoids them from sexually transmitted diseases and also avoid the risk of unwanted pregnancy. And last but not the least, seek medical help anytime if you have an unusual discharge from your genital area or irritation or a persistent lower abdominal pain or what you can find out from your menstrual diary, a change in your menstrual pattern which has occurred very recently and which is affecting your daily life, which is affecting your normal day-to-day activity. That's all. Thank you.
Oh, thank you,
Thank
ma'am,
you, ma'am. It was a very
for such a wonderful
interactive.
interactive session. Now, I would request uh, to have a question from the student side or the teacher side, whoever wish to. Sikha, you can just take that round also.
Yes, sir. Ma'am, someone is asking that Colimax is a good medicine or bad?
I didn't get you, Shikha. What
Ma'am,
is that?
someone is asking Colimax is a good medicine or bad for taking?
Corimax is basically a brand name, and what I can make out from your question is basically it's a painkiller, maybe over the counter drug. If it is a painkiller to be taken during menstruation, just check your composition, and definitely composition is available at the back of every medication, and you can check it out on Google. If it is an antispasmodic, definitely it's a safe thing to be taken during menstrual pain.
And ma'am, blood clots are common during periods.
That depends. If you are in a supine position for long, आप सोए रहते हो और उसके बाद उठते हो, तो definitely blood is accumulating inside your vagina when you are asleep or in a lying position. और वो blood जब बाहर आता है in the form of clot, that is absolutely normal. But if अगर clot आप एक्टिव जब हो रहे हो उस समय भी क्लॉट पास हो रहा है एंड उसके साथ अगर पेन हो रहा है तो दैट इज समथिंग व्हिच इज नॉर्मल abnormal.
Ma'am, Comiflam is a good painkiller or not?
Combiflam is a very good painkiller, but yes, it definitely causes gastritis also, so it should be taken in empty stomach. You can take it after taking food.
And ma'am, Drotin M.
Protein M is also a good painkiller, definitely designed for pain. It is an antispasm, so alleviate your pain in a better way.
And ma'am, which type of medicine we have to take in extreme period pain?
You can take Protein M. If it is unrelieved, you can take Combiflam also. But if you have to take more than 2 or 3 painkillers a day, you should.
Okay, ma'am. And ma'am, Meftap,
Left spasm,
uh,
painkiller, anti-spasm, especially designed for menstrual.
and ma'am, one question from my side, ma'am. Can we overcome from PCOD?
PCOD, as I told you, is a hormonal disturbance. It's like diabetes. It can never be cured. So PCOD is a lifestyle disease which has to be managed with lifestyle modifications.
মেনস্ট্রুয়ালের উপর না এটা আমাদের সেমিনার
Any other question from the audience side?
Ma'am, kindly some remedy for mood swings during menstrual cycle.
Mood swings commonly occur just before your menses. That is explained in scientific terms by कि आपके hormones सबसे lowest levels पे होते हैं, and that's why you have a low mood tend to have. So, as you know, you are expecting menses. So you always remind yourself this is because of that. And definitely yoga, meditation सब help करते हैं to keep yourself calm.
Okay, ma'am. Ma'am, one more question is there that from last 2 months, someone has not having come periods of her.
जैसे मैंने कहा, it depends whether you are sexually active or not. If someone is not sexually active and was having a regular menses till now, and now she is not having menses since 2 months, पहली चीज होती है कि एक अल्ट्रासाउंड होना चाहिए. अल्ट्रासाउंड में अगर if everything is normal, तो she should wait. If anything abnormal is detected, so she should consult a doctor.
And ma'am, one more question. Ashoka wrist syrup is helpful or not?
That's a Ayurvedic preparation. Many people report it being very helpful. It can be taken.
Ma'am, one more question. Blood flow varies every month. It depends on food also.
No, what I told you na, कि your food doesn't decide what amount of flow you are going to have during menses. खट्टा खाने से blood बढ़ता है. So no, definitely no.
And ma'am, vomiting is normal during periods.
This is what we call premenstrual symptoms, PMS. बहुत लोगों को vomiting होती है during periods. It should be managed symptomatically with anti-vomiting drugs.
The college at menstrual cycle पर conference was.
Okay, ma'am. Thank you, ma'am. It was a very interactive, informative, and brightening session for us.
So, took us a movie, Padman, to start talking about menses. Now, can I expect that you people be free to talk about it among yourself and your other people in the family? Can I expect it?
Yes, ma'am. Yes, ma'am. Sure.
Yes, ma'am.
Okay, thank you.
Now I invite Dr. Urvashi ma'am for giving away vote of thanks.
धन्यवाद शिखा. सबसे पहले मैं डॉक्टर शमशू नेहाल मैडम प्राचार्य रांची विमेंस कॉलेज को हार्दिक धन्यवाद करती हूँ जिन्होंने इतने अच्छे आयोजन के लिए स्वीकृति प्रदान की है. उसके बाद मैं डॉक्टर नेहा कौर को धन्यवाद करती हूँ जिन्होंने इस कार्यक्रम में सहयोग किए हैं. ये बहुत ही बेहतरीन टॉपिक था जिस पर लड़कियों को जानकारी बहुत ज़रूरी है. मासिक धर्म को लेकर के जिस कई अवधारणाएं हैं, मिथक है, जैसा उन्होंने बताया, अनुपमा सिंह ने बहुत ही अच्छे तरीके से उन्होंने समझाया. स्त्रियों के लिए, लड़कियों के लिए ये बहुत ही बेहतरीन मुद्दा है जिसके बारे में हम लोग अक्सर साझा नहीं करते हैं जानकारी. पीरियड्स को एक तरह से मान लिया जाता है कि वो छुपाने की चीज़ है. कई वर्जनाएं हैं, जैसा मैडम ने भी बतलाया कि महिलाओं को कहा जाता है कि आप धार्मिक किताबें नहीं छू सकते, धार्मिक स्थल पर नहीं जा सकते. उनकी जो तकलीफ है उसको दरकिनार करके एक तरह से मना दिया जाता है कि आप लोग इसके लिए छुप कर रहें, लोगों के सामने ना आए. लड़कियां इन्फेक्शन को छुपा लेती हैं. कई बार ऐसा होता है कि बीमारी जो आगे बढ़ जाती है तब जाकर सामने आती है. कई तरह की सामाजिक और सांस्कृतिक वजह है इसके पीछे, जिसकी वजह से हमारी लड़कियां, बड़ी औरतें भी गलत धारणाओं में फंस कर रह जाती हैं और यह मिथक जो है वो टूटना ही चाहिए. डॉक्टर अनुपमा सिंह का मैं बहुत बहुत धन्यवाद करती हूँ. अनुपमा मैडम ने इतने अच्छे तरीके से बच्चियों को समझाया और हम सभी सुन रहे थे इस चीज़ को. एक खाने पीने की चीज़ों से ये सब कोई दिक्कत नहीं है. लोग मान कर बैठे होते, खट्टी चीज़ें नहीं खाना है, ये नहीं खाना है, ऐसे मत करो. वो सारी चीज़ें हम सबको भी एक नई जानकारी यहाँ मिली है. मैं डॉक्टर अनुपमा सिंह जी को बहुत बहुत धन्यवाद करती हूँ. रांची विमेंस कॉलेज की छात्राओं, शिक्षिकाओं की तरफ से आपका हार्दिक धन्यवाद.
Thank you.
Everyone for बहुत बहुत धन्यवाद आप सबको भी, और आशा करूँ कि आप लोगों की कुछ.
थैंक यू मैम. थैंक यू डॉक्टर अनुपमा. बहुत ही अच्छा सेशन था. एंड आई एम श्योर जैसा कि उर्वशी मैम ने कहा कि अब हम इसको एक टैबू की तरह नहीं लेंगे और मेंस्ट्रुअल साइकिल्स और इससे रिलेटेड जो भी परेशानियां हमें होती हैं इसे हम खुल के डिस्कस करेंगे, क्योंकि डिस्कशन ही एक तरीका है जिसके थ्रू हम, जैसे आपने बहुत सारे मिथ्स को बस्ट किया है इस सेशन के दौरान, तो मुझे लगता है कि हम उन मिथ्स को अपने साथ लेकर नहीं चलेंगे और इस पे और ज्यादा से ज्यादा चर्चा करेंगे और खुद को बहुत सारे परेशानियों से दूर रख पाएंगे। थैंक यू सो मच, बहुत ही अच्छा सेशन था। हम चाहेंगे कि हम फिर आपको कभी एक बार ऑफलाइन सेशन में इनवाइट कर पाएं और ऐसे कुछ वर्कशॉप्स करा पाएं जो हमारे बच्चों के लिए बहुत अच्छा हो। थैंक यू सो मच। थैंक यू एवरीबडी, थैंक यू ऑल द पार्टिसिपेंट्स फॉर ज्वाइनिंग मी। थैंक यू शिखा, थैंक यू उर्वशी मैम।